pull back their time to negotiate and move forward with a more government-heavy plan. So I'm certainly hopeful that Senator Enzi will be successful. Please call his office with words of encouragement when you have a moment. And then one more thing about cap and trade before I take a couple of questions. The cap and trade bill that passes the House is completely unacceptable as an alternative for America. And I'm also hopeful that the U.S. Senate will dramatically change that bill. Not only does it cost the American people more than any other increase in history, but if the United States shut down its entire economy, totally shut it down, and China, India, and Russia do nothing, the consequences to the global climate are nil. Because now China is the biggest emitter of carbon. So if we're really serious about the climate, we should be working with China to adopt the same best available control technologies that are used right here in Campbell County on our state-of-the-art mining operations. I want to thank you for your patience in standing in the hot sun today, and I'm grateful for your attendance, and if we might, may we take some questions? Yes, ma'am.
Thank you for coming into the heat today. I've had cancer for 12 years now. I go to Portland, Oregon to the doctor out there. Will that still be available to me? He's the premier doctor for what I have. Is that still going to be available?
Do you have insurance?
Yes, I do. I have good insurance.
Through an employer?
Yes.
Or through your employer?
Yes.
Well, then the answer is not necessarily, because your employer, if you're especially employed by a large employer, can shift you onto the public option. Now, that does not necessarily mean that you will lose your doctor of choice, but you will then have a bureaucrat, or more than one, making the decision for you about whether you can continue to see that physician. The bill creates 33 new entitlements and 53 new government agencies. So if you can navigate the new bureaucracy, you may get to see your same physician.
Okay. Now, I'm sorry, I have a couple questions. I know I need to hurry. Will that stop research and development for new medicines coming out for cancers and MS and that type of thing?
Not to my knowledge.
Okay.
Research and development of new medication should continue. However, as you know, that research, the research costs are high and are reflected in the costs of certain medicines and prescription drugs that we all have the benefit of. So the drug companies can recoup the costs of the R&D. If they negotiate group agreements for healthcare medications, and certain alternative medications are deemed to be appropriate, it may be that some experimental either drugs or procedures may not be available. It's also theoretical. That's another problem that many Americans, including myself, are having with the bill. Those questions need to be answered before this bill is voted on.
You know, there's so many people that rely on this type of thing. Also, like, I pay well, right now I get my medicine free because I'm in a clinical trial. But if I wasn't, I would be paying $20 for my medicine because of my insurance company. So the medicine's going to be about $4,000 a month. Wow. If they go to this, who's going to pick that bill up?
Well, and of course, I can't answer that, and right now no one can. Maybe it shifts the cost to the government, shifts it to the taxpayers. The interesting thing is even after you aggregate the savings from Medicaid, the savings from reducing waste and fraud in Medicare, the reimbursements in Medicare, the taxes, including the surcharge, the penalties, and the tax associated with the Democrats' bill, they are still $250 billion short of paying for it, $250 billion short of paying for it. The bill that I am co-sponsoring is totally paid for by taking all of the stimulus monies that have not been spent so far and applying them to the Republican health care bill, along with a 1% reduction in the budget for of discretionary spending by the federal government. And so that would totally pay for the Republican version, which is not a government option type of bill. But it does expand, the bill I'm on does expand programs like S-CHIP, State Child Health Insurance Program, and it also provides other opportunities within states for the availability of insurance to those who have pre-existing conditions. Other questions?
I have a question.
Yes, yes, ma'am.
I'm a nurse in Campbell County, and I would like to know what is the most effective thing that I could do as a voter and a nurse advocate, not only for my geriatric clients, but other people like this lady and people in my age group, the baby boomers. What can I do to stop this? What would be the most effective thing?
Well, I will try to hand out some cards while you're still here, that in addition to those, that say how that you can visit a website that answers questions or suggests ways that you might be an activist in your community to help stop this huge expansion of the federal government. And we'll get some of those to you. They're in the car, I hope. But I would also encourage you to visit with friends and relatives who live in other states. Your entire congressional delegation is a no on these bills. And so we need your support with people who reach out to friends, neighbors, constituents, patients who are in other states to communicate with their members of Congress. So the groundswell comes from every congressional district in the nation. That makes a huge difference.
I also have another question. Is it fact or is it just internet rumors that Obama is advocating people would be able to do like a Dr. Kevorkian type on their lives? I read that on the internet today at a reputable website.
I don't know the answer to that, so I'm not going to offer an opinion. If you want to read, there's a website called CapitalLC.org, www.CapitalLC.org. That is a law firm from Florida that has gone through the entire bill, line by line, can refer to it by page and section, and makes references to those types of concerns. In some cases, the language is too ambiguous to discern the actual intent, but in some cases, the language is so unclear that it does create the specter of those kinds of concerns through a rulemaking process that would have to follow adoption of the bill. So I strongly encourage you to go to www.CapitalLC.org. That is not an official congressional website. It is an independent law firm in Florida who's gone through the bill page by page and may be able to shed some light on your concern.
I understand that part of what the proposed Democratic bill will do is say there's this commission that's already in existence that evaluates drugs for effectiveness and says if this drug is effective and is cheaper than this drug that's effective, you have to go to the cheaper drug. My question is, because I have stomach problems and heart problems and so on and so forth, some of the cheaper drugs won't work because
Yes.
I have to be on a different drug.
Yes.
but as I'm understanding it, it's you will take the cheaper drug, period. Is that correct?
Again, that may be correct. That is certainly implied in these bills, because you will have a bureaucrat between your doctor and you if you are on the public option. And so that's possible, and you are correct. There are a number of physicians that are very concerned that when certain generics don't work for certain patients, and that the more expensive brand name prescription is effective in certain patients and is effective only for certain patients. Yes, doctor.
Thank you. Well, I'm that doctor, Bob. That bureaucrat's going to be having a big crowd on his shoulders. But there are some claims that were made by the administration, and I just want to take about 2 minutes to go through them. One, the promise was that this system was going to save our medical system some money. Number two is that it's going to be universal care and everybody will have insurance. Three, that the public option will not drive out the private insurance industry, will not result in a single payer system. And four, that there would not be $1, and I'm quoting the president on that, $1 added to our deficit. Now, as I see it, every one of those claims is fraudulent. And I don't see how anybody can really expect to be able to compromise with them unless the Democrats are willing to jettison their whole program and accept the Republican program, because this is the essence of Obamacare. So I hope that our Republican members back there will not, in an attempt to get along, to go along, vote for even a halfway measure with these fraudulent claims. And these are the basis of Obamacare. So that's my thoughts on it, and I hope that you and the senators will remember that. Thank you.
Thank you. And to some of your points, the Congressional Budget Office has said that this will cause 6.5 million more Americans to lose their jobs, that the bill is not paid for, that 114 million more Americans will probably be shifted from insurance to Obamacare, as you put it, because of the difference in cost. But it's paid for by the American people. So it is, the president's desires for the program are certainly not borne out in the bill. The bill is completely inconsistent what the president says his plan should be. Yes, sir.
On the cap and trade issue, aren't we a lot better off if the Senate does absolutely nothing? Because if the Senate passes something, the House has passed something, and then you get a bunch of people together that decide how it's going to be. And so, I mean, to me, that's the worst of both worlds.
That's right.
Yes. The nation is better off if the Senate does nothing. And I've been talking to certain companies, including coal companies that have a presence here in Campbell County, about if we can kill cap and trade this year, what is an alternative they can live with for next year? And so I've been asking them, could they live with a cap in the year 2050 on carbon emissions that gives them a 40-year window to use their ingenuity and great American minds to reach these caps without the consequential financial burden on the American people. And so those are the kind of things that are being discussed by the very companies that have a presence in this county as an alternative for next year. So even the providers are looking ahead to provide alternatives that rely on America's superior skill in solving problems without government heavy-handed interventions and high taxes. Yes, ma'am.
I read that one of the ways you were going to pay for this was by taxing small businesses to help pay for the healthcare. And as it is now, small businesses have a problem making it as it is.
Yeah. Federal income tax collections for the year are down 18% from individuals, and they have been down 57% from corporations. That is a reflection of the state of the economy. So if a business has to absorb even more taxes, they will have to lay people off. That's why the CBO projects another 6.5 million jobs will be lost. And it's just tremendously harmful to small business. I'm very concerned. Obviously, you can tell. I don't believe that this is overreaction. I think that this is tremendously consequential in a very negative way to our country.
Yes, I keep hearing everything about Medicare and Medicaid as a prime example of government-ran health care, and I am a victim of a different kind that I think people are forgetting about, workman's comp. Workman's comp is a government-ran health care and health insurance. I had a serious injury when I was 21 years old. It took 9 months to get an MRI. After that, it took 8 months to get a bone scan. I had to get selective injections in my back for pain. It was supposed to be a three injections over 6 weeks. I got one. 6 months later, I was approved for the other 2. So it did nothing. And I guess my question is this a prime example of government bureaucracy standing in between a patient and his doctor? And is this what we can expect from Obamacare?
You know, I can't answer your question specifically, but the fact that there are bureaucrats between you and your physician involved in the cost of your health care, your accessibility to your health care, and so forth, it is consistent with what we can expect from Obamacare. Tom Lubnow, I'd like to thank you for coming, Tom.
Cynthia, we're competing in a global